Good morning. This is Scott Harrow with
Good
the
morning.
UMHS Alumni Association, and today we are speaking with UMHS 2023 graduate, Dr. Angelica Marrero. And Dr. Marrero, I want to welcome you today. And can you just briefly fill us in on where you're going to be working this summer?
Yeah, well, I will be starting my dermatology research fellowship this July at the Center for Clinical and Cosmetic Research in Florida. And this is under the mentorship of two well-known dermatologists that are also assistant professors at the University of Miami Miller School of Medicine.
Okay, great. And you recently had a couple really wonderful articles, research published rather, about some serious dermatological conditions. Could you just briefly maybe talk a little bit about that research for
Yeah, of
people out
course.
there? Okay.
Yeah, well, research during medical school is a little challenging, and publishing can be challenging. However, if you're proactive and you have like a goal in your mind and you really want to publish, it's totally achievable. And well, the first paper is about a medication that was recently approved for lung cancer, and we reported the adverse effect that was not reported in the literature before. And the
Okay.
second one, yeah, and the second one is about a patient that had maple syrup urine disease, which is a very rare disease, and you don't see these conditions very much. So that's why we decided to write about these cases.
Wow. Yeah. And I looked at those and those look like pretty rare cases.
Yeah,
So really, really exciting stuff you're working on. What just for our current and prospective students out there, I know that a lot of people don't know a lot about dermatology as a specialty,
yeah,
but what should they know if they want to pursue dermatology simply and not just that it's not just about cosmetic procedures, as you've
yeah.
told us?
Okay, yeah, most of the people think that dermatology it's all about Botox or uh, acne or eczema, but dermatology goes beyond that. It basically encompasses oncology, autoimmune diseases. There's a lot of pathology and histology there too, and a lot of surgical procedures too. In a typical clinical day, basically, yes, you have follow-up patients with acne, but you also have a lot of patients with biopsies that you have to
Right,
perform
right.
those.
Very true.
Yeah. And you also see pediatric patients. That's something that I also like. So it's a very diverse field.
Okay. And you're from Puerto Rico, and UMHS has a huge amount of students from Puerto Rico. Why do you think UMHS is so popular among Puerto Rican students?
Yeah, well, I believe that Puerto Ricans desire to stay like together and to build a community of Puerto Ricans. So I believe that we think like, wow, UMHS has a lot of Puerto Rican students, and we have like a sense of familiarity in the school. And yeah, it feels like home, basically.
Okay,
And yeah.
great. All right. And why did you personally choose UMHS over other med schools?
Well, I decided to go to UMHS because I like the idea of rotating in different areas in the United States. And I believe that I have gained a lot of cultural sensitivity by rotating in different areas in the United States. And that was like the primary reason. And I also like the idea that we can rotate here in Puerto Rico. Many of us want to, do the residency here. So that's a great opportunity that we have.
Of course. And dermatology is a really competitive specialty, as you know. What would you say to current or prospective students that are interested in dermatology? Should they do the elective rotations in
Yeah.
dermatology, or what's your advice?
Yeah, well, my advice would be that obviously you try to honor your basic sciences and also your clinical rotations, but try to do away elective rotations too. We have two departments of dermatology in Puerto Rico, one in Ponce School of Medicine, that's a new one, And the one that I did my elective was in the Department of the Recinto of Ciencias Médicas. So yeah, you have options. And also don't get discouraged because yes, it's a very competitive field. However, if you are very determined and you have a dream, go for it and don't get discouraged about what other people might think or say. And try to get as much as experience as you can in the field, doing the elective and publishing. Publishing is very important in dermatology. And there's a lot of pathways to get into, either
Okay.
doing a research fellow or doing a residency in other field first.
Okay, and I think that's really sound advice. And
Yeah.
finally, is there anybody that you'd like to give a shout out to at UMHS? Anybody that helped you along the way, whether it's, on the staff or faculty or clinical rotations? Anybody out there that you'd just like to thank?
Yeah, well, thanks to Dr. Roy. I'm not sure if he's in the university now or
Mhm.
he's still doing pathology there.
I'm not sure.
Oh, well, Dr. Roy, thanks to him, I love histology and I want to become a dermatopathologist in the future.
Okay. All right. And is there anything else that you'd like to add, Dr. Marrero, that we haven't covered? Anything you want to say to the current or prospective students, to alumni, anything out there, Puerto Ricans in general?
Um, I think that we have covered everything.
Okay,
Yeah.
great. All right. Well, I want to thank you so much for your time, Dr. Marrero, and I
Okay.
wish you all the best of luck in your upcoming residency this summer, okay?
Thank you so much.